Hello everyone, welcome to my channel Physiotherapy. So in the low frequency current, I had completed in the current, and next topic is galvanic current. So let's discuss about that, how you can write in university examination for good marks for 3 to 2 marks. So let's discuss about galvanic currents. What that mean in the galvanic current? It is come under the muscle stimulator to stimulate the muscle, which is a direct electric current or interrupted direct current, also known as. And duration is more than pulse duration is to be 1 to 300 millisecond, and the duration is to be more than 10 millisecond. So that is the galvanic current introduction, and where we can use and what is the types. Let's discuss in the further. So galvanic current basically used for muscle re-education and the transfer of ions into the iontophoresis into the current continuously flow into the galvanic muscle stimulator. So it is modified because there is variety of types inside the muscle stimulator machine, and it is interrupted because it sends the stimulating signals into the which is impulses, which is a different waveform. So let's discuss about the types. First is a rectangular shape. So the rectangular shapes galvanic current is increase gradually and stay sometimes and decrease gradually. It means a constant sudden increase, short stay, and sudden fall down impulses which have to be shown into rectangular type of galvanic current. It is not shown into the our modality. It is inside. It is like based on under the gadgets. So basically, where what is the frequency is to be 10 to 1600 millisecond, which is stimulate and trigger the muscle and nerve to re-education. And rectangular galvanic current of type, which is used for the iontophoresis, which is drug delivery into our body. We are discussing into the further videos. So that is the rectangular kind of galvanic current. Second one is triangular kind of galvanic current. So it is sudden increase and sudden decrease of the impulses, which is used for completely denervated nerve and muscles. Where we can use and treat the particular patient is to be a Bell's palsy, radial injury, radial nerve injury, ulnar nerve injury, and the median nerve injury. So that is to stimulate the particular nerve to trigger over there and perform the and facilitate their movement if there is loose and forget about that. Third one is a trapezoidal kind of galvanic current. So trapezoidal kind of galvanic current is a gradually increase their intensity and stay some time and gradually decrease their impulses. So that is the trapezoidal current. There in like pulse width is to be 100 to 500 millisecond, and where we can use the trapezoidal kind of galvanic current in the flaccid paralysis, which is comes under the paralysis, which is a floppy kind of body is to be there, and the full range of motion is to be shown, but the strength is not occur due to the paralysis of the inner like dermatomes or myotomes completely, or like that is the trapezoidal kind of galvanic currents. Fourth one is a sawtooth kind of galvanic current. So that is the gradually increase you have to be shown and sudden decrease down without taking staying at the over the truck region, and this gradual increase and sudden fall down get induced into our body to perform or facilitate the muscle re-education. So basically in the clinic and hospital practices, the physiotherapist and doctors are taking the sawtooth kind of galvanic current for the treating the person for muscle re-education. And their frequency, pulse width frequency is to be 100 to 600 millisecond, which is very good for a patient for muscle re-education and facilitate and like educate their muscle to like combine their activity like in denervated to innervated and partially innervated, and like is to be performed the functional activities to be good. Next is to be last to be depolarized kind of galvanic current, which is their polarity reverse into the positive manners and stay sometime and decrease into the, and sometimes is to be so zero impulses. So it take a time into the into the negative velocity impulses, because there is a zero intensity pulses, and after that the impulses is to be decreased down or into the goes to the negative. There is no any kind of impulses and stimulation and tingling so on the patient. So that kind of machine or like depolarized galvanic type of current, where we used a denervated muscle or also the muscle re-education. So basically that kind of depolarized current we have not much more used in clinical practice, but there is a type comes under the galvanic current, so we are studying in this video. So that is the type, their frequency is to be depolarized is to be 100 to 600 millisecond, which is very good for the patient, so that we can use comparatively the sawtooth or depolarized kind of current for the muscle re-education. We prefer the sawtooth because it uh, gradual increase and sudden fall down, it is trigger or stimulate the particular nerve or denervator or innervator to facilitate their movement. So that is the types. Last one is physiological effects. So what kind of physiological effects we have to use on if patient have applying the these galvanic current machine, which is muscle stimulator. So first is contraction of the denervated muscle. So we have already discussed about what is denervated muscle. Where let's discuss about in a brief. So there is a arm or body part, and their supply of the nerve, like which is median nerve, there is cut down here, and the sensory information or like motor information is not pass out. So wherever there is supplying, wherever is there a muscle, so there is all of the function is to be lost, losing them. So completely denervated is to be all of the functional movement is to be lost down. So that is the known as the denervation of the particular muscle. So we are taking the galvanic current for stimulation and trigger. So contraction of the denervated muscle was to be shown the physiological effect of the patient. The stimulation of the sensory nerve. What does that mean? Sensory nerve is to be like a myotone, which is send the signals to our reflexes or like sensory touch or pain. So on that time, the denervation of the sensory fibers. So galvanic current facilitate to the nerve fibers to connect over their denervated area, and uh, also the into the exercise therapy we have to be perform the combination of their to maintain the strength and perform the activity of daily living or to the normal function of the muscle. So that is the stimulation of the sensory nerve. Stimulating of the motor nerve, you have to know about that the denervated nerve has to be cut down. So on that time, the galvanic current we have to be taken to facilitate the movement, and that is the stimulating the motor nerve fiber to like forget about their normal movement. So on that time it will be reactivate the muscle movement. Prevent venous and lymphatic stasis. What does that mean? Venous and lymphatic stasis mean a patient have like into the limbs have to be flaccid kind of paralysis. So our calf muscle is a secondary heart, so that will be pushed upward against the gravity, the blood or venous drainage to send the blood into the heart and or deoxygenated or oxygenated blood to perform to like decrease the chance of ischemia or hypoxia into the body. So on that time of flaccid, there is a loosen and forget about the muscle activity, which is also take example is to be calf muscle. So galvanic current is to be induced over there, and it will be facilitate the movement and reactivate and strengthen down or trigger the calf muscle to prevent the lymphatic drainage and prevent the lymphedema over there. Improve local circulation. So if patient have this reason have to be circulation is to be low during the any kind of paralysis or like or if patient having the Bell's palsy or Bell's palsy. So stimulating the motor points by taking the pen electrode. So on that time it will be like treating the particular region to improve the circulation and decrease the acne. So most of the dermatologists will have to be taking the galvanic current for the iron to process and into the acne reduced process. So that is the improve the local circulation for the facilitate the muscle function. Next is to be prevent contracture. What does that mean? If patient have forget about their movement or also the muscle has to be going to the wastage, so the contracture is to be there because on that time there is a spastic kind of paralysis is to be there. The contracture has to be happen into our muscle. So there is a rigidity occur into our muscle. So their circulation is to be slow down. So galvanic current is to be stimulate over there. You have to be shown onto the particular videos on. Also we have you are going to the clinical practice. So shown the galvanic current there we have to be induced with a particular reason to stimulate the muscle or nerve fibers to facilitate the circulation and muscle re-education. Last is to be maintain hypertrophy of the denervated muscle. So what is the maintain of hypertrophy? If muscle is to be go for hypertrophy, it means the wasting of the muscle is to be goes to be hyper. It means the muscle is not active properly and the wastage of the muscle activity is to be superior level. Or time on that time the muscle is stimulated is to be performed over there, and their sawtooth type of current we have applied over the particular patient to facilitate the nerve movement and trigger the motor point if the patient have to be acute or chronic denervated nerve or muscle injury. So that is the physiological effect you have to be shown into the patient. So that is the first part of the galvanic current. Thank you.